Hello everyone, welcome to my presentation, and today I will be discussing Quetiapine and its pharmacokinetics, pharmacodynamics, intended and adverse effects. This presentation will also talk about an interdisciplinary team working together and important counseling factors related to the drugs. So what is Quetiapine? Quetiapine belongs to an atypical antipsychotic which is used to treat schizophrenia, bipolar disorder, and as a supplement for major depressive disorder. Quetiapine is commonly known as Seroquel by brand name, and it works by blocking dopamine D2 and serotonin 5 as T2 receptors, which help regulate mood and psychotic symptoms. Moving further to the pharmacokinetics of quetiapine. Quetiapine is absorbed through the gastrointestinal tract, reaching peak plasma concentration in about 1.5 hours with bioavailability of 9%. It is 82% protein bound, primarily to the albumin, and metabolized in the liver by the enzyme CYP3A4, producing an active metabolite called norquetiapine. Quetiapine is excreted mainly in urine, about 72%, with an elimination of half-life of 6 to 7 hours and 12 hours of norquetiapine. As for the pharmacodynamics, quetiapine's primary mechanism of action involves D2 receptor antagonism, which reduces positive symptoms of schizophrenia. It also acts on 5-HT2A receptors, alleviating mood disorders and anxiety. Quetiapine is also known for its sedative effects mediated by histamine H1 and alpha adrenergic receptor antagonism. These properties make it useful for treating sleep disturbances and anxiety alongside antipsychotic effects. However, quetiapine is not effective for long-term treatment. There are several intended effects of quetiapines, but also the several adverse side effects. Quetiapine intended effects include the control of psychotic symptoms like hallucinations and delusions, the stabilization of mood in this bipolar disorder. It also reduces anxiety and helps in sleep. The common side effects include sedation, weight gain, dry mouth, and dizziness. More severe side effects can include metabolic syndrome with increased risk for diabetes, tachycardia, and extrapyramidal symptoms like tardive dyskinesia and neuroleptic malignant syndrome. There should be a great collaboration between the staff for better possible outcomes. Quetiapine is classified as a Schedule 4 prescription-only medication in Australia. It is prescribed by psychiatrists, general practitioners, or other licensed prescribers. Clinical considerations include regular monitoring for metabolic effects such as blood sugar and lipid levels. This is critical because quetiapine can increase the risk of metabolic syndrome and diabetes. Furthermore, attention must be given to the interaction with CYP3A4 inhibitors or inducers, as they can alter quetiapine's effectiveness or lead to toxic effects. Patient education and adequate treatment plans are more than important for better drug uses. It is important to educate patients to swallow quetiapine as a whole without cutting or crushing the controlled release tablets, and to avoid taking with food. Patients should be aware of potential side effects such as drowsiness, weight gain, and dizziness. Additionally, avoiding illicit substances like cannabis and amphetamines is essential, as this can exacerbate psychotic symptoms. Patients should also understand the risks of extrapyramidal symptoms and tardive dyskinesia with long-term use. Let's review the presentation with this question about the drug quetiapine. Thank you.